Hello guys, this is Dr. Palaniappan Manikam. In this video, we have a very special guest. Her name is Dr. Janani, and she is an expert in pediatric developmental disorder, including autism. And I know her right from her medical school because she's my junior in PhD Medical College, which is the best medical college ever. I'm going to shout at the top of the school, top of the mountain. So she's my junior, and I'm so glad that she's doing very well. And we would like to hear more from her regarding the pediatric developmental disorders, and also have some points about autism and other disorders as well. So without any delay, I'll invite her on the session. Hi, Jenny.
Hello.
How are you?
I'm good. How are you?
Good. Beautiful. So I've given you so much build-up as a pediatric developmental disorder specialist, which you are. And I'm so glad to be on board with you. And this today's session is just as a general discussion about, like what is autism, how people are confused about it, and just general specifics about how we can make this misconceptions and general theory a little bit better for my audience. Basically, that's what the whole goal is. I know you deal with this on a daily basis, and it's a very personal topic to me as well. So I want to ask you to start with. In US, I think it is being happening in India as well. That even with the slightest delay in any kind of development, and for example, if a kid has to speak within a particular time of time, and if it is not, then they just throw this autism word, and this autism word in Ketona, people are like really upset, and they feel like there is nothing, their life has come to an end. So for that kind of situations, can you educate us what is actually autism?
So autism is a neurodevelopmental disorder. And if we are hearing the word more and more nowadays.
Right.
It's because everyone's more aware and the diagnosis is made more often than in the past. It comprises two major diagnostic criteria. Like one is social deficits, and like lack of back and forth conversations, lack of socio-emotional reciprocity or understanding relationships. And the second major criteria with autism, which the child should meet, is there can be restricted repetitive behaviors. There can also be restricted interests, or sensory abnormalities.
I see.
Or they can also have just like this fixation to routines and adherence to routines, that it's so concrete that they're unable to shift from their routines.
I see. Can you give us some examples, like repetitive behavior? Now they just keep on doing the same thing.
Yeah, like it can be just repetitive motor movements. So so it can be like spinning, hand flapping, or it can be rocking back and forth. And sometimes it doesn't have to be just motor movements. It can be repetitive verbal stuff, like we call it echolalia. So they just keep repeating the same word again and again.
Echolalia. Now I'm bringing back my pediatrics. இந்த வார்த்தை நான் எங்க கேள்விப்பட்ட மாதிரி இருக்கு. Echolalia. Yes. So you say the same word repeatedly.
Right. Or repeating a sentence or the end of a sentence, or repeating what they heard earlier in the day, or a movie phrase or something. So it's just repetitive behaviors, actions, body movements, or verbal language.
So there are like certain specific criteria. Right. Is it easy to meet the criteria or to have a diagnosis of autism?
I would say they have to meet. So there's like specific like pointers that they have to meet. Like a specialist can easily examine, get your history, your child's history, and see if they meet the criteria or not.
I see.
And then recommend next steps.
I see. I see. So there are, you said two categories. One was the repetitive movement and repetitive verbal behavior. The first one I was not very clear. The social deficits, you they cannot maintain a conversation, and if you talk to them, they don't reply. Is that what it is?
So it's basically it's like they are not unable to understand the social concepts
Mm.
of of, and it can vary from child to child. That's why it's so hard to like put it in a
Yeah.
box.
Yeah. I see. I see.
But to like be very specific, it's more a very abnormal social approach.
I see.
And also like failure of just back and forth normal
Normal
conversation,
conversation.
like how we are having.
I see.
um, and uh, and also like just there can also be deficits in nonverbal behaviors
I
like
see.
eye contact, body language. For example, they can be more robot like how they
Mm.
talk,
Robotic. Right. Right.
and they can talk in a monotone. So,
Mm.
and
Mm.
then very limited understanding of peer relationships,
Right. Right.
um,
I
yeah, or
see.
connections.
I
But
see.
again, this varies because that's why it's called autism spectrum. So it's
Right.
not like it's the same child. Um, it cannot be replicated. Uh,
Right.
so
Right. Right.
each child is very unique and different.
Okay, okay. So, the biggest problem and all, I think the biggest confusion that young, not, I shouldn't say young dads, not me, but I should say dads with young kids have, or dads and moms, young with parents with young kids, is, you know, they, I have a feeling that they just throw this word autism on each and every developmental delay. So, what is this autism spectrum disorder, and where does this range, and when should be the patient or the parent should be worried about?
Um, so I feel like it's like if you go to a specialist, like a pediatric neurologist, pediatric psychiatrist,
Mm,
um, like if your pediatrician has doubts, they usually go ahead and make referrals to a developmental pediatrician, pediatric psychiatrist, or neurologist,
right.
who are well equipped to make this diagnosis because they see this time and again, like in their
Mm,
everyday clinic.
mm,
So once they get the diagnosis, I I would try and get the resources because obviously there is something your clinician, your doctor is worried about for
right.
your kid.
Mm,
Um, so the treatment has to come in earlier, like speech therapy or occupational therapy or special ed setting or not. So I would say, like, for the parents to not fixate on the diagnosis too much or
uh,
worry too much and try to get earlier treatment recommended by your physician
I see.
because the delays cause developmental delay. Like, like don't
Uh,
help your kid, they make it worse.
okay. So can I'll summarize what I have understood. So what I'm saying, what I'm seeing, what you're saying is, so let's say that your pediatrician is suspicious of something, and I know it's a big term like autism, and that's really a big blow to the family. But don't take that as the end of the world. And this is an autism spectrum disorder, starting from a very mild deficits to all the way to severe deficits. And the earlier the treatment, better the outcome.
Right.
Uh,
Yeah. And also, you were asking, like, what does the spectrum
mm,
encompass?
mhm, mhm,
It is basically again going back to the diagnostic criteria, which
mm.
is a full range of socio-emotional communication delays
I
or
see.
repetitive restricted behavioral delays, sensory problems, and all of that. So it's a whole range.
Ah.
So it's hard to, and there are so many reasons and presentations. So it's just hard to say.
Right. No, I see. I see. I
Yeah.
see. I completely hear what you're saying. So there are two kinds of parents, right? One is, when they hear the word autism, they want to do everything possible. They want to go to the specialized team. They want to make sure everything is okay. They take it in the relatively right way and to get the treatment option. The second group of parents is that they go to this phase of grief, that they in a phase of denial that this cannot happen. Let's just give it some more time for the kids to develop on its own. How do you tease that out, and then what will be your general recommendations as an umbrella term?
I would say if your child is young and the doctors are concerned, it's definitely better to start. I know it's hard, you're grieving, you're disappointed, your child is having this condition. But again, like you said, it's not the end of the world.
Hmm.
But you can do something proactively to help your child instead of not helping them. And it can be just therapy. You don't have to start a medication right away or anything. It's more like, how you can support your child to get them moving forward. So, yeah, I would definitely recommend that.
Recommend. Okay. What are the treatment options usually? What you guys do? You guys do speech therapy and other services as well. Can you explain a little bit more?
So, so there are two types. So the first one is just behavioral techniques and therapeutic techniques,
Hmm.
where the psychologist team and the behavioral technicians, they are all involved.
Hmm.
And then the medication piece, where the doctors, the MD, the psychiatrists are involved.
Hmm.
So and the psychiatrist can also help with behavioral therapies. So I would recommend, like, if the child is very young and not speaking or having difficulties with some other
Social.
developmental delays or difficulties, I would definitely recommend getting a speech assessment
I see.
from a professional speech therapist and seeing how they can support them. And also, if there are some behavioral issues because of
Mhm.
the autism, then getting a behavioral technician. We call it ABA therapy here. So it's applied behavioral analysis,
I see.
looking to see, analyzing why the behaviors happen and what can be done to help those behaviors. So kids are recommended, like, at least 2 hours a day, roughly. Many kids get ABA therapy.
Got it. Got it.
There's also a very a specified treatment called PRT, or pivotal response treatment,
Hmm.
for autism and speech, which helps nonverbal kids develop some speech. So that is like they would have to meet the criteria, and parents do the program and all of that. But again, that's very evidence based to help kids with speech
I see. I see.
before the age of 6.
Hmm. Looks like this is not like an one man army. Huh? This is
It is not, yeah.
ah, wow.
Yeah, and then you have to have an occupational therapist too involved.
Oh my God. Wow. Oh, this is just talking about this is like so depressing most of the times. Um, I mean, how do you handle this? You handle it on a daily basis.
Yeah.
There should be some positive outcome, right? So when we delay, right? So tell us about if we bring our patients earlier to you, what will be the outcome?
For example, when a non-verbal kid or minimally verbal kid comes to us when they are 2 or 3, we are able to identify and
Mm,
plug them in with all the services, like
mm,
services starting right from school,
mm,
therapy at home, therapy at school,
mm,
occupational therapies, speech therapy,
mm.
medications if needed, right? There are so many of these things. And then the studies have shown that those kids uh, do better in terms of language development, behaviors, and also IQ and overall speech,
Mm.
compared to kids when they come to us when they are 18 years old, who are nonverbal and who have a lot of behaviors. Then there's very limited we can do with their
I
brain
see.
development.
Ah, ah, ah. But you do see like on the autism spectrum disorder, when they come with mild to moderate, the outcome prognosis is good.
It's yes, of course, when they are milder and with better speech
Ah,
and
they make sense.
development, and also if they have slightly higher IQ,
Hmm.
we see that their overall development is better and their prognosis is better
Better.
compared to non-verbal kids or kids with very low IQ. then it's a little bit.
Yeah, I see, I see. Um, I know this is a common misconception that people with autism are diagnosed from birth, right? That's not the case. What is the usual common age that you see?
Usually, just generally in the community, it's picked upon by pediatricians between the ages of 3 to 4,
3 to 4, yeah.
because that's when they notice, oh my gosh, the kid speech, there's something wrong with their speech, there's something wrong with their behaviors,
Mm.
or just their meltdowns or tantrums, like something more needs to come in.
Mm.
So it's usually picked up around that age. But if you're going to a specialist early on, it can be easily picked up by someone who has a background in autism.
I see. So the treatment options for milder patients have good prognosis, and even for moderate symptoms, we can definitely make them better. And the presentation is around like 3 to 4 years of age. Um, are you seeing this more common these days, Janani? I'm very hesitant to ask a question at all.
It is common just because of the awareness
I see.
that parents and teachers have and are able to pick up these symptoms early on.
Okay.
20 years ago, I would say there was very limited awareness in the community as well as
Mm,
teachers or even among physicians.
mm, mm.
Now, many of them are able to pick up these delays and
Mm.
refer to us. So that's probably
It's a
one
good
of
thing.
the reasons we are seeing it more often.
More often. Okay. Okay. And the most important question that I think everybody would be wanting to know is what can, as a parent, do to prevent autism in my kid? Or is there any way, is there that nothing that we could do? It's something genetic. What do you say?
So, yeah, there are many genetic disorders that can cause autism. There are many gene variations, mutations, deletions that can cause autism. And sometimes we don't even know the significance
Mm.
of what the deletion is or the genetic variation is.
Um,
So I would say the parents cannot blame themselves,
right.
thinking I could have prevented this.
I see.
Right.
Mm.
So
Mm.
that's the first thing. Parents cannot blame themselves.
Mm.
The other common causes are if there are like pregnancy, delivery complications, preterm birth, low birth weight, and some in utero infections. They can cause autism.
I see. I see.
But
So preterm birth is before, let's say, you are being 38 for 40 weeks would be the gestation. So if the baby is delivered around like seventh month or sixth month, then the risk of autism goes up.
I would say the younger, the
Even younger.
even younger, we see sometimes kids who are delivered at like 5 or 6 months, and
Ah,
so very low birth weight, prematurity. They are definitely have a higher risk.
I see.
Not all the kids are going to get it, but
I see.
it's associated with a higher risk of autism.
I see.
Um, but there's nothing that we can do to
Due
prevent.
to prevent. I see. I see. How about this conception of, people are delaying the pregnancy and they want to make sure that they are settled in life, and then elderly, maternal and paternal age has a contributing factor for autism. How true is that?
So it's a little bit controversial. Like there are like studies that, I mean, some papers that show that's not true, and
Okay.
there are like this other school of thought saying it's probably true, especially for paternal age.
Paternal age.
Um,
Not maternal age, paternal age more.
yeah, that
Mhm.
and again, that's
It's
just
not,
out
we don't know.
there, right?
Mhm.
It's out
Mhm.
there, and I feel like there should just be more evidence
I see.
to
I see.
suggest that, which
I see.
I feel like.
So we cannot clearly say that, hey, this is what the reason, but based on the available evidence, maybe there's a probable association, but we're not sure.
Yeah,
Hmm. Maybe we're not sure. Okay, okay. And the first thing that I really want my audience to take this point is please don't blame yourself, right?
yeah,
Please don't blame yourself. There is nothing that you could have done to prevent this, but at least if you come out of that denial state and then intervene early, the outcome is pretty good.
yeah.
Outcome is relatively good, relatively good. As a for the kid per se, medication. We talked about all the other treatment options. 3 and 4 age. has this happened to older age as well, like 10, 12?
Yeah. So in our clinic, we see kids as young as 2 years old, and I have some patients who are really older,
Mm,
diagnosed many, many years ago,
mm,
like young adults or even adults like 40 years old.
right.
Yeah, it's an array of ages and different medications, different treatment options, and different therapies. But one important take-home point is to get the help from your school. I know many parents stress upon the importance of education and academics. So
Mm,
just making sure it is a syllabus that meets your child's needs and
mm,
something that your child can do,
mm.
rather than um, just forcing so many things on your child that they might not be able to do.
I see. So, let's say that we come out of that denial and then we say, hey, what, I want to get all the best treatment option available for that particular kid. Based on what you're telling me, looks like it has a multiple treatment lines. So, should they have to go to a center that has all these things, or it can be managed by a pediatric neurologist, or how do you see in the ideal world?
I would I would say a center definitely is better
Better.
because they'll have it's a one-stop shop.
One
So
stop shop.
they'll have, you know, hopefully a good center will have like all the allied therapists, behavioral technicians, psychologists for therapy,
Mm,
family therapy for patients and parents, and then the psychiatrist who can prescribe medications if needed, and also can do long-term assessments. It's not a one-time assessment. Your doctor needs to follow up on your child's growth and development and behaviors. Some of our patients stay with us for 10 plus years.
right.
So a center would be ideal. But then if you are in a setting without a center, then having like a specialist and your pediatrician follow up on these things would be ideal.
Right. Okay. Okay. And then the most controversial topic that we always hear about is vaccines causing autism. But I'm not have you answer the question at all. I'm going to tell that it is not true. So it's not true. Especially COVID vaccine causing autism is absolutely not true, and there is no research supporting of any vaccine at all. But I'm
Okay.
going to ask you: is it still a common misconception that you see in your group of patients?
Yeah, we get asked this quite a bit, and I agree with you. Vaccines don't cause autism. There have been several studies about this substance called thiomersal in vaccine
Mm,
causing autism, but it's not.
mm, mm.
Or MMR vaccines causing autism
Yes.
doesn't. It definitely doesn't. Studies have disproved that time and again.
Mm,
So I would definitely recommend getting all the vaccines because there are higher chances of a child getting these communicable vaccine preventable diseases and dying than
right.
than autism. So I would definitely recommend getting any vaccine available.
Right. So another controversial question. I'm not. If you want to skip, it's okay. So in my limited literature that I know about pediatric neurology, one of the biggest risk factors that I've seen in the past or heard as well is about the peer pressure of around like between like 5 to 15 years of age. How do you look at it? Is that contributing to autism at all, or is it just like hyped up? What is your thought on
I don't think peer pressure contributes to autism.
it?
Um, but kids with autism, especially when they're teenagers or preteens, they start like higher functioning kids
Mm,
start noticing the differences between themselves and their friends.
mm,
And if they are not getting any support or help at that point in time, there are higher chances for anxiety and depression,
I see.
and other comorbid disorders for autism, mood
I
disorders. So definitely identifying a child on the spectrum, if they are around that age, and helping them with social skills or academic skills or other supports is very important.
I see. I see. What I hear from the tone that you are saying is there is a genetic predisposition and then some triggering factors that can present as a clinical manifestation of the disease.
Yeah,
Uh,
yeah, but nothing that
Nothing that could
causes.
have been prevented.
Right, right.
Mm,
Yeah.
mm,
There
mm.
can be like so many disorders, like neurological disorders or other disorders that can cause autism and
Uh,
highly linked to autism. Many genetic disorders can cause autism, but a completely normal child at age 13 cannot become suddenly autistic. So it's a neurodevelopmental disorders
Correct,
uh,
correct,
identified early on in life.
correct. Any other misconception that you need to clarify so that you can get less phone calls?
I would definitely say getting help as soon as possible is very important. Just thinking that this is going to go away or they don't need help does not help the child.
I see.
Um, and
Mm.
then definitely get them vaccinated. There are parents who believe around 2 years after this vaccine this happened, or around 3 years after this vaccine this happened.
Mm.
You're noticing around that time because that's when the child's development is very noticeable in terms of language and other things. There are
Mm.
also a few disorders where there can be regression around that age that can be tied to autism, but it's not because of the vaccine. The regression can be because of a different reason or
Right,
some other some other neurological disorder or a genetic disorder.
right. Have there been any studies like research like if it is genetic component involved, if one sibling is affected, the likelihood of next one?
Yeah, there are several studies, and definitely like having a sibling or a twin with autism increases your chances of having autism. Yeah.
Diagnosis again. Wow.
Mhm.
I really don't know how you do this. I really don't know how you do this. I know it's the most toughest job that you ever have, right? You have like distressed parents and the child that needs further clarification. I absolutely salute your work. This is not easy. This is not easy at all. Running a YouTube channel is much easier. It's much easier. What is the thing that is making you looking forward? There should be something that gives you satisfaction. I want to know what that is.
I like pediatrics and I like working with very young kids
Hmm.
and seeing them get better. Like many of them, at least giving them
Chance.
yeah, and
Hmm.
and and just helping them like um, with their behaviors or mood or getting them gen-
Almost back to
that's
normal.
right. I
Hmm.
wouldn't say back to normal, but um,
Close to what they could be.
yeah, like give, maybe it would be worse off without these services,
I
but they
see.
might be better with these services, so that kind of keeps you going.
Wow. Again, I salute your work. It's not easy. We need more people like you. Tell me more about what is going on in Tamil Nadu, India, and basically, I know the state of the art practice might be here at your place, but what do you think in back home, and what do you think we can do to improve?
I would say back home first, removing the stigma,
Um,
very important. I
mm,
see many parents hyper focus, hyper fixate on the education system,
mm,
scores, and academics in India, and that's still happening.
mm,
Even though I know the trend is changing, but it's still
mm,
happening, and
mm.
it's very stressful. I would say definitely getting the specialists involved, and I am not sure if the specialists are accessible in every city and every town.
Mm,
But pediatricians to be the eyes and ears for
mm.
the neurologists or pediatric psychiatrists and making referrals
I see.
instead of saying your child is normal. If the parent is bringing up some issues with it, like make sure you look into it and escalate to the specialist if needed.
I see.
And uh, and then things that can improve is definitely more centers focusing on this,
Mm,
more
mm,
therapists, more behaviorists, psychologists focusing on this, availability of genetic testing, availability of psychological or neuropsychiatric testing,
Right.
to look into the various nuances of this is very important.
Wow. This is an ocean. This is not a simple thing. This is an ocean of information that we'll need for the family, and also from a doctor standpoint, it has to be like a multidisciplinary approach.
Correct.
So we see autistic kids in our trust, Aishwaryam Trust in Madurai, and the what we are seeing is there is significantly less awareness about what autism is. Again, the pace of denial is significantly there. And we have a pediatric neurologist who goes and then takes care of these patients on a daily basis. But the difference that we are seeing is, one second. I wish I will show that video to you. It's very heartbreaking that if they would have come early, we're pretty sure that some kind of motor abilities could have been prevented, and also speech could have been advanced. So how do I put this? So let me tell you. So if a person has concerns about that his kid might need some referral. So you said pediatrician might be the way to go. But what are the things that we can look for so that we can bring that concern to pediatrician?
Yeah, I think that's a great question. And the early signs and symptoms are very important. So if you feel like your child is not developing language compared to their peers, they are behind in speech, they are behind in social skills, they are unable to connect or make friends, or even connect with parents. They don't make eye contact, they don't respond back to you, they are nonverbal, they have just odd repeated body movements, they seem to be in their own world, they are not taking in what's going on around the environment, and then any other behavioral issues, it can or it may or may not be present, but just meltdowns, irritability, sensory sensitivities, hypersensitivity.
How do you differentiate temper tantrums versus abnormality?
So I would say, like, if all these are present, all those are present, and in addition to that, like extreme irritability,
I see.
or
It's not like one little thing of my kid is like throwing temper tantrum for like
right, it's yeah. So you have to have, like I said, they have to meet the diagnostic criteria, and in addition to that, they can have all these other things.
I see. So the biggest take home I really want to have my audience listen to this is, don't be hesitant to bring these concerns to the pediatrician. Number one. Number two is, it might not be even autism at all. Even if it is, it could be a very mild spectrum disorder that could be easily corrected in case if it is being referred properly.
Correct.
Okay, super. Again, I don't know how you do this. Again, I salute to all the pediatric neurologists. It's an amazing thing that you guys are doing. What is the one thing that you will tell us to take home from this interview, so that people who are concerned about autism or who have autistic kids can learn, in addition to all the beautiful points that you said?
I would say definitely seek services soon. And trust the profesgonals.
Trust the professionals.
Don't research, but trust the professionals to help you. There are
don't Google. Don't Google.
There are also so many international conferences in many centers now available via like Zoom or the tele platform. So what was not previously available to everyone is so much more available thanks to the pandemic. So they have to be on the lookout.
Including this interview.
Including this, right?
We would never thought about it.
So they have to be on the lookout and sign up for these parent conferences. There are tons of resources, conferences that are available, and even very specific treatment options or therapies too, that you can discuss with the experts. They just have to look into some of these websites or like universities.
Any websites that you can give us?
I would say major academic centers in the US or outside of the US usually list ongoing conferences
I see.
for their autism centers.
I see. So like Harvard, Mayo, John Hopkins. Okay, I see.
Yeah, any of those. So I would
Mm,
say you can go ahead and sign up for those if it's open to everybody,
I see.
and they can get something out of these conferences, and they can also look into resources, books. But I usually say everything should be evidence based.
Yes.
Don't be your own doctor.
Yes, exactly. Yeah, yeah, yeah. So that's why you need that team.
Right.
That's going to be the team. Okay, super, super. Thank you, thank you again. I can't thank you enough. Thank you so much for your time, Janani. This is absolutely a wonderful session. Thank you again.
Thank you so much.
Thank you, Janani. Bye bye.